So what is CCBHC? CCBHC stands for Certified Community Behavioral Health Clinic. They are considered a new Medicaid provider type whose purpose is to provide thorough mental health and substance use disorder services to individuals. We were one of the first centers in Texas to be CCBHC certified. Let's start by taking a look at the history of CCBHC as it relates to Texas. In 2016, 24 states, including Texas, were provided the opportunity to receive CCBHC planning grants. 8 centers in Texas, including Burke, met the requirements to become a Texas CCBHC by the end of the grant period. In December 2016, SAMHSA announced the 8 states that would be participating in the 2-year demonstration program and who received the associated funding to further implement CCBHC. Unfortunately, Texas was not one of the states selected. Despite this disappointment, Texas still continues to move towards all centers being certified as CCBHCs. The objective behind the creation of CCBHC was to strengthen mental health and substance use services, to further integrate physical and behavioral health treatment, and to increase the appropriate use of evidence-based practices. CCBHC services include providing care that is comprehensive, trauma-informed, and recovery-oriented, serving individuals in locations other than the office, and partnering with other medical providers, meeting certain criteria for staffing, availability of services, and quality reporting, among others. There are 9 types of services that CCBHCs must provide. Crisis mental health services, including 24-hour mobile crisis teams, emergency crisis interventions, and crisis stabilization. Screening, assessment, and diagnosis, including risk assessment. Patient-centered treatment planning. Outpatient mental health and substance use services. Outpatient clinic primary care screening and monitoring of key health indicators and health risks. Targeted case management. Psychiatric rehabilitation services. Counselor services. Peer support and family support. Intensive community-based mental health care for members of the armed forces and veterans, particularly those located in rural areas. CCBHCs are expected to be reimbursed under a different payment system, an enhanced Medicaid reimbursement rate. However, this does not apply to Texas at this time. Care coordination is the cornerstone of CCBHC services. Care coordination is coordinating physical health care, behavioral health treatment, whole health information, and individuals' needs. It is considered a deeper involvement in referrals, follow-up, missed appointments, and transitions within and across the system. Think of care coordination as closing the loop on referrals. It more fully integrates care in order to achieve improved outcomes and increase efficiency. So what does that mean for us at Burke? Prior to CCBHC planning and certification, we already provided many of the 9 required services and met a number of the criteria. Since Texas was not included in the demonstration grant for CCBHC, we have worked to further align with their values, even in the absence of associated funding. There have been some challenges along the way, and one such challenge was in regards to broadening care coordination services. However, in 2018, we were able to start the Care Navigation Program due to funding from Texas House Bill 13. The Care Navigation Program allows us to provide care coordination and nursing services to a small number of individuals within Berk's behavioral health population. In June 2019, we will be receiving a grant from Episcopal Health Foundation for the purpose of more fully implementing care coordination services. These services are for individuals in our behavioral health program who show evidence of high physical and or high psychiatric need. So what does this mean for you as staff? Well, it means you're probably going to hear more about care coordination activities involving individuals on your caseload. You'll hear more about primary health screenings and substance use services. You should also start to see improvements related to more fully integrating care for the individuals we serve. Above all, you can expect that we will continue to provide high-quality, professional, and compassionate care as our teams work together to improve lives.